Good morning, everyone. Welcome back to Atlanta & Company. I'm Christine Pilara. Reproductive Biology Associates was established in 1983 as Georgia's first IVF treatment center and specializes in helping bring new life into this world. Today, Dr. Scott Slayden is here to talk about Ovarian Reserve. Good morning. It's always a pleasure to see you.
Good to see you, too.
So what is Ovarian Reserve?
Well, Ovarian Reserve is a difficult concept to go over, but basically it is how many eggs remain in a woman's body. So, for example, if you were born in 1973, your eggs were made in 1973, and that's your supply for your whole life.
I heard that once, and I thought, that is incredible.
It is.
When you really think about that as a baby, you are born with as many eggs as you have.
That's right, your whole supply. So we want to determine when women want a baby, or even maybe before they want a baby, what's left. Because everybody has a different supply. There's an average supply, and then there are people who vary. Some people have more, some have a lot less. And we want to identify women who have a lot less reserve.
And how do we go about testing for that?
All right, so the tests have evolved a lot over the years, and I'll tell you, the best test of all is your birth date. So if you feel great and you're 35 and you look great in the mirror and you're exercising and you're eating well, it doesn't really tell you how many eggs you have. So we want to look further, and the way we look further is check blood work, and the most modern test is called AMH. It's anti-Mullerian hormone, and it can be drawn at any time during the menstrual cycle, at any age.
Oh, good.
One thing that would impact it would be birth control pills, but maybe just a little impact. It's a very, very important test.
And it sounds like it's a very powerful test, so should all women who are wishing to conceive, should they consider this?
Well, if I'm an insurance company, the answer is no, because we don't want to pay for that.
Exactly.
But if I'm a woman, and if I'm a couple, and I want a baby in my future, but I'm not ready for a baby now, I believe, and many of us believe in our field, that you should have this test done at any age, and what we're looking for are outliers. We literally have women in their 20s with the reserve of a 40-year-old, and that tells that woman she cannot wait to 40 to reproduce, and then we've identified that person. Very important test.
Okay, so you mentioned insurance. So does insurance cover it, or does it all depend?
It can. We have a good number of patients who have generalized insurance where it will be covered, but what is the cost? I mean, the cost is basically 6 months worth of Starbucks, maybe.
Yeah,
it's $70. It's less than or equal to a new pair of shoes, yet the data you get is so important.
Absolutely.
So it's worth it even if you have to pay for it, I believe.
And this may seem like a silly question, but is there anything that we can do to improve or increase our egg reserve, our egg numbers?
I hate to give the answer, but
the
answer is no. You can't. You're born with what you have. Now, you can prevent some problems. A lot of young women like to smoke. Smoking damages eggs, and it damages them permanently. So the moment you quit, you're left with damage, but at least you're not damaging them further. But short of that, the best way to prevent the problem is actually to identify it exists and then make plans based on that identification, which means testing before you're ready to conceive, because you've got what you got. You mentioned identifying the outliers. Are there examples where you might have somebody who's my age, 45, and might be shocked that they have lots of eggs in their reserve, or not? That's not usually the case. Well, it's actually really funny you mentioned, because today and yesterday I had two patients. They were both, one was 43, one's 44. Their AMH level, one was 3.2 or so, and one was 6.0 or something, which your AMH level is far beyond what they should be. The higher it is, the more eggs you have. So yet, when we have that, we look at the woman's birth date. And it tells us the true story. They have a lot more product, but the age of the product still is what it is. And so yet they have a lot more opportunities to work with it.
And what advice can you offer to our viewers who have had the test done and they have the results? So what's the next step?
Okay, so the next step is counseling, and this is where it all falls apart. We as people, as humans, are not a number. So whether it's a cholesterol level, if your cholesterol is 250 and all your grandparents live to 90, it may not matter that much. So AMH is the same. You need really appropriate counseling, because a low number just means you have low numbers of very good eggs, and you need to get to it sooner. But a high number, if you're older, means you got to get to it anyway, even if you have high numbers. So speaking to somebody who's really knowledgeable about the topic in depth is the way to handle the situation.
And then they can go about freezing the eggs and preparing for the
proper... Well, exactly. So if you're, let's say you're 25 years old, 30 years old, we identify a lower number and you just don't want to reproduce, or you're not even married, we can freeze the eggs and use them later because they'll be preserved. Is a possibility.
Great information, as always, Doctor. I appreciate it. Appreciate
so
having
much.
you.
Thank you.
And if you would like more information about Reproductive Biology Associates, give them a call. It's 404-257-1900, or simply log on to the website. It's rba-online.com. And this segment was paid for by Reproductive Biology Associates.